A CHIP stands for a Community Health Improvement Plan. You can think of it as a guide or a blueprint that communities use to address really big priority areas related to health as identified by a jurisdiction. And a jurisdiction can be a county, a region, a city, however that community sees fit.
The Center for Rural Engagement's role in the CHIP process is one of really engaging deeply with communities to help them build a team of stakeholders that are interested and invested in improving health outcomes in their communities. So we do that by working through our faculty, graduate students, and community partners to develop a plan that really envisions a healthier community.
Utilizing this process to prepare for any other further emergency or pandemic-like event, I think the number one thing I think is important is knowing your resources for any emergency. So what I have, everyone else needs to know what I have to offer, and for us, we need to know what our community has available. I think if we could have gone back, rewound 2 years, and had this process in place prior, we might have done things differently early on in the pandemic. It helps us to rely on the relationships that we've created to get the work done. So I do think just the framework that we're using in itself is a model that we could use going forward in preparation for emergency preparedness.
One of the things that we've been able to see is just improvement in how communities gather together and breaking those silos. So typically we found 2 or 3 organizations really being passionate and interested in moving the needle forward on some critical health issues, but now are seeing more momentum because more sectors are coming to the table, such as transportation, housing, economic development, education. So those non-traditional partners have been a real added value to the Community Health Improvement Plan that has not been there before.
Our health is really the one thing that we truly own. So whenever we identify gaps in health needs, if we have poor health in the community, that's going to impact all kinds of things related to environment, social, money, employment. So, that community engagement piece is where we see adoption either rise or decrease depending on if the community buys into what's being done.
As a small community hospital in rural Indiana, it's extraordinarily important that we have community support. And to gain that community support, we have to understand the community health and wellness needs, as well as engage the community in addressing those gaps. So getting the community support from business leaders, individuals, various partnerships, it's extremely important to our success in fulfilling our mission to our community.
So many of our tactics that were tied to our goals have already come to fruition. And we have done a really great job of, in the past, heart screenings, lung screenings, we do a men's health screening every year. So that committee decided that this year we wanted to offer that to women. And so in August of this year, we are doing a women's screening event that is totally free. It will allow women that are underserved, underinsured to be able to have a free annual exam.
We need to have our communities be places that people want to live, that want to stay or want to return to. And a big part of that is having a healthy community, having that community infrastructure that allows for healthy practices, be it trails, be it parks, greenways, but also programs such as weight loss programs through the hospital, the availability of clinics. Mental health is a big thing. And if we have those available or can develop those in our community, that makes our community not only healthier as a whole, but more attractive to be a community that people want to live in, want to bring their business to, want to bring their family to.
Without universities, we wouldn't really have a lot of data to show what decisions need to be made in health or in business in general. Communicate that to the community, to individuals to say, here's what we're working on and why it's important.
Frequently, a lot of the issues identified by communities are well addressed by the assets that we have in the School of Public Health, the School of Nursing, Social Work, and surprisingly, perhaps to some, in the School of Art, Architecture, and Design, and in our expertise in Parks and Recreation. And it's important to know that this is a planning process, but that Indiana University, through these schools, is invested and active from planning all the way through implementation.
It's critical that we have buy-in from the public and we engage them in these processes, specifically as it relates to health, because a community's health is key to our economic development successes. So it's been phenomenal just to see all of those folks come around that same table, that same computer screen, right? And for IU to help facilitate that conversation has just been critical.
Through our community health needs assessment, we've identified 2 top priorities. The first one being substance abuse, both education and the treatment, and then also mental health.
With this, we have pursued a couple of different grants. Those grants are helping us to facilitate some peer recovery resources. It's going to bring those groups together and make a stronger resource for those who are dealing with addictions.
And because of that, we're able to secure federal funding to create a stronger recovery community that provides opportunities for increased education, increased mentoring and support of peer recovery coaches, and then also more opportunities to strengthen local infrastructure to address substance use and mental health.
Being back in my own community, be able to help people in my own community is a big thing for me. So I like doing the peer recovery work because you get to walk with people and you get to take them to treatment centers, you get to see them come home, and you get to walk with them day in, day out. So that's a very rewarding thing for me.
So I just love the community support, the camaraderie, and then the collaboration that we have.
I think it's important to understand that the Community Health Improvement Plan process is so impactful because it is custom to a specific community. It's their vision that they're achieving, but it's a replicable process that any community can do in order to improve community health.
When Hoosiers unite and work together for real solutions, we can overcome even the most difficult challenges. Each plan includes strategies that fit local needs and draw on the strengths our resilient rural communities already possess. It is these same strengths that make rural Indiana a big reason why our state is so successful.
The Indiana University Center for Rural Engagement wishes to thank Dr. Priscilla Barnes, the School of Public Health, our community partners across rural Indiana, the state of Indiana, and the Office of Community and Rural Affairs for making these transformative health initiatives possible.